had an infection in my foot and was in the hospital for about 2 weeks. I had to have a toe amputated. That's when I found out they had diagnosed me with diabetes.
And that's Larry Havens there, who is getting specialty care through Central Health. Now, more of that type of care is headed to Rosewood-Zaragosa Health Center in East Austin, and Central Health is transforming the center into a new specialty care clinic, and it is slated to open in fall of 2023. Joining me right now is Mike Gieslin, President and CEO of Central Health. So, Mike, thank you so much for being here with us this afternoon.
Thank you for having me.
So we know that the clinic will provide specialty care. Can you talk about what changes will be coming and how that will improve the care for those you serve, many of them lower income and without insurance?
Exactly. Well, currently we are allocating funding to redesigning and renovating the Rosewood-Zaragosa Clinic. That's been a familiar place in Austin for decades, and it's at the corner of Weberville Road and Pleasant Valley. And through these renovations, we will turn this into a specialty care clinic that offers 6 specialties ranging from cardiology to nephrology and neurology to really build out the high-functioning healthcare system that our patients deserve.
Okay, so you had a healthcare equity plan. You identified some gaps there. Can you talk about what gaps you identified and the challenges that really come along with those?
Well, what we did is we conducted the first ever community needs assessment that really focused on the population living below 200% of the federal poverty level. And then we had listening sessions, what we called Voices of the Community, where we listened directly from patients. And then through those two, we created the North Star around health equity, and that is helping people live the healthiest life possible. And through that plan, we've identified gaps ranging from moderate to very significant that we're going to work over the next several years, and that work has started today to fill those gaps, and the Rosewood-Zaragosa is one example of how we're completing that work.
Okay, and we know that obviously since COVID, that's created even more challenges, especially for the population you serve. And so what now are some of the challenges within that population and some solutions besides the new clinic that you are using to really address those challenges?
Well, one challenge around access to health care are those that have transportation challenges. And so one of the things that we want to wrap around this specialty care is transportation assistance. That should not be a burden to getting health care.
Okay, and then also lastly, is there anything else that people will see differently at this historic clinic that you, like you said, it's been in the community for so long? Right.
Well, it's going to look a lot different on the inside once it's remodeled, but configuring it to be a good, positive patient experience is first and foremost for us. And making it a place where patients feel welcome and it's culturally affirming. And so these are things that, you know, it speaks to the bricks and mortar, but it also speaks to the type of care that we want to bring to people.
Okay, Mike, thank you so much for your time, as always.